Hi, I'm Dr. Vince Bellonzi. Let's talk a little bit about sleep apnea. I've discussed before, and this has come from other researchers, Dr. Jeffrey Bland, other people have talked about oxygen as being a limiting nutrient. And it is a nutrient. It's supposedly abundant, but it can be a real problem if you don't deliver oxygen to your tissues, if you don't get oxygen to your body, right? You're gonna die without oxygen and atmosphere around. So we don't want to be, in a sense, asphyxiated, even, say, as we sleep. And there's a lot of studies on sleep apnea. So I want to talk about that a little bit. Sleep apnea has been found to be related or associated with cancer, with dementia, with a lot of conditions where you don't heal. Diabetes is a situation, in a sense, of limiting oxygen, because the sugar actually causes the hemoglobin of the red blood cells not to be able to carry oxygen. You don't deliver oxygen as well. You can't heal tissue. So there's ulcerations, there's loss of the function of tissue. You lose eyesight, you lose peripheral nerves. And it's partly because you can't deliver adequately the oxygen. Well, if you've got sleep apnea, which is becoming a very common thing, there's a lot of sleep centers and sleep studies being done. And the majority of people being found to have a sleep apnea situation, meaning that they stop breathing at night. It may be for a very short time. It may not be all night. But if you're not breathing, you're, again, not going to deliver oxygen. So that's where they're tying sleep apnea to disease. And sleep apnea it's not a disease necessarily that you have to live with, if any disease is. Sleep apnea is a situation where the airway can't stay open or it's blocked for some reason. The snoring often goes along with it, but it's really the situation that you're not breathing. So what I've found for practically every case of sleep apnea is there's three factors that need to be addressed. One factor commonly known is that if you've got sleep apnea, it tends to associate with being a bit overweight. And what happens is fat accumulates and there's fat pads, there's areas, and it tends to close down the airway, not allow the airway to stay open as well. And you get a situation where you stop breathing because the airway actually closes. So, of course, losing weight can have a big impact on sleep apnea. But also, I've found that inflammation is part of the apnea situation. Inflammation is probably the basis of every disease out there. It's at least incorporated into it. Whether you want to talk about heart disease or hypertension or cancer, any disease out there. But sleep apnea has an inflammatory component. People that have a lot of allergies tend to have more sleep apnea. So I've found that if you do things to reduce that inflammatory status, perhaps find foods people are reacting to, things in the air, of course, grasses, trees, molds, things like that, but also things from the environment. Perhaps they've eaten too many chemicals in their processed food or been exposed to too many things. But if there's inflammation, especially around the area of the airways, that's going to do the same thing as that fat deposit. It's going to swell the tissue, and it's going to close down the area available to transport air. And maybe when you're awake, you can be more aware of it, and even with some difficulty keep breathing. But when you're asleep, your brain's automatically trying to keep you breathing, but you can have a abrupt stoppage. And the other thing that I found that's really tied to sleep apnea is people's level of physical activity. And there's smooth muscle in the airways. So just like you would build any muscle, you can increase the ability of that smooth muscle to hold the airway open. So I found that if you get people more active, especially aerobically active, and the problem is a lot of people, if they do aerobic activity, they're doing very low intensity. They may think that it's better for weight loss. It's actually not. But you've got to increase the intensity of the exercise and really breathe hard. And if you do that, you actually get better muscle tone, better muscle ability, strength in those airways. And I found that people that exercise can solve sleep apnea if they go from what they were doing to something perhaps a little more intense, because now they have the muscle control to hold the airways open. So if you affect, and interval training is the best way to do that. You do intervals of very intense activity, short intervals, and then you have a recovery, and you repeat this. Wind sprints are intervals, and there's other ways to do interval training. We'll talk about that in another video. But if you increase the muscle abilities in the airways, if you decrease the inflammation of the airways, if you lose perhaps a little bit of weight, you can solve sleep apnea. If you've got sleep apnea, you probably want to explore using a CPAP or some other machine to help you keep the airway open and to have some oxygen available to deliver to your tissues. It's important. But if you continue and do some things on your own, you won't need that CPAP forever. So just like drugs, just like anything else, you want to use tools that are available if you need them now. But then your strategy really should be to get self-sufficient again. So with sleep apnea, if I take care of my diet, if I take care of my exercise, if I take care of inflammation, if I do some things proactively, then I won't have the need of an apparatus to help me breathe. But if you're not breathing on your own effectively, then you need help. So keep that in mind, because sleep apnea is associated with so many diseases because it results in less oxygen delivery. So this is Dr. Vincent Bellonzi. Keep this in mind. There are ways to redesign your lifestyle and fix it yourself. Live healthy, live happy.